Now it's time for us to dive into our first career in healthcare, respiratory therapy. The team at HaysMed is with us today to showcase the fastest growing healthcare career in Kansas, respiratory therapy.
Welcome to HaysMed, where our team of skilled healthcare professionals work endlessly to care for our community. Today, we're stepping into the shoes of our dedicated respiratory therapist. This vital role supports patients throughout Western Kansas of all ages, helping them breathe easier and live better, especially in challenging times. Our day begins with a morning shift report at the Respiratory Therapy Department. Here at HaysMed, respiratory therapists collaborate with other nurses, doctors, and ancillary staff to review patient cases, discuss special care needs, and prepare for the day.
Good morning. I'm Chastity Thacker, a respiratory therapist here at HaysMed. My day can involve anything from routine checkups to emergency interventions. I love that my role is all about helping people, whether they're here in the hospital or a part of the wider Hays community.
First stop is the intensive care unit, where HaysMed respiratory therapists work with critical patients, many of whom rely on ventilators and advanced respiratory support. We provide specialized respiratory care that's vital to their recovery.
In the ICU, I closely monitor each patient's oxygen levels and ventilator settings to make sure they're breathing comfortably. The ICU can be intense, but I'm proud to provide this essential support to patients and their families.
To work as a respiratory therapist, you'll need specialized education and training. Most respiratory therapists hold an associate's degree in respiratory therapy, which includes coursework in anatomy, physiology, pharmacology, and respiratory care procedures.
Many respiratory therapists also complete clinical internships where they work directly with patients under supervision. Certification is key in this field. After graduating, respiratory therapists must pass the National Certification Exam to earn their credentials and are often required to obtain state licensure. At HaysMed, we invest in our staff's ongoing education right here in the Education Center. We also frequently host students as they go through their clinical rotations.
Some respiratory therapists choose to pursue a bachelor's degree or even advanced credentials, which allows them to specialize in areas like pediatrics, critical care, and pulmonary diagnostics. Over in the emergency department, respiratory therapists are on call for patients experiencing sudden breathing issues due to asthma, trauma, or allergic reactions. Quick, decisive actions here can make all the difference.
In the ER, I might be called to provide emergent breathing treatments, respiratory support, or even assist with CPR if needed. Working here means being ready for anything, and it's rewarding to know my skills can help in emergent situations.
Respiratory therapists at HaysMed also provide routine care for patients with chronic conditions like COPD or cystic fibrosis. Each session is a chance to improve someone's quality of life through targeted treatments and education.
I spend time with patients to ensure they understand their treatment and how they can care for themselves at home. Education is a huge part of what we do here at HaysMed, helping our patients feel confident managing their symptoms.
HaysMed respiratory therapists also perform diagnostic tests in our respiratory lab, assessing lung function through pulmonary function tests, or PFTs. These tests are essential in diagnosing conditions and tailoring treatments.
Here I'm testing lung capacity and airflow to get a clear picture of a patient's respiratory health. These tests help us create an individualized care plan, making sure each patient receives the best treatment possible.
After a day of rounds, treatments, and testing, our respiratory therapist completes patients' charts and collaborates with other HaysMed team members to keep patients' care seamless.
Documentation is key. It helps everyone stay on the same page about a patient's care. Here at HaysMed, we're all about teamwork and sharing updates to make sure our patients get the best care from every member of the team.
Respiratory therapy at HaysMed is more than just medical care. It's about supporting our local community one breath at a time. From critical emergencies to routine care, our respiratory therapists make a difference every day.
Hi, my name's Hunter Bell and I'm the cardiopulmonary manager here at HaysMed. Supporting our respiratory therapists in their clinical roles is imperative for myself, our physicians, and our administrative team. Working here at HaysMed is special in the sense that we can cultivate talent at a very rapid pace due to our volume and our RT-driven protocols. Respiratory therapy is an incredibly rewarding career. I love knowing that we are helping our neighbors, friends, and family members live healthier lives, and I could not be more proud to be a part of this incredible team.
Thank you for joining us for a day in the life of a HaysMed respiratory therapist. If you're passionate about healthcare, problem solving, and community care, maybe this career path is for you. Thanks for watching. Visit HaysMed.com for more information on our services and career opportunities.
I want to welcome our respiratory therapy panel to answer questions about this career opportunity. Joining us this morning from HaysMed are Hunter Bell and Brian Fonesteel. Good morning.
Good morning.
Will each of you take a turn by telling us what drew you into a career in healthcare and/or respiratory therapy? Hunter, let's start with you.
Sure. So my grandfather was a physician, so pretty much everyone in my family was driven into the healthcare field through either nurses, paramedics, nurse practitioners, things like that. Um, and so when it came time for me to choose a career, I went through each path. I went on a nursing rotation. I went through radiology, and when I got to respiratory therapy, I really enjoyed that because we, are so involved in patient care, but we also have the freedom to kind of go where we want, and we're a part of anything that's really fun. So.
Brian?
Yes, I got into healthcare at the age of 14. My town of 1,500 people, the only place that had a job at age 14 was in the nursing home. So I started out in the kitchen, and then when I became 16, I went and got my CNA license, and I worked as a CNA throughout high school. When I graduated high school, I went off to college with the ambition of becoming a pharmacist. However, after a couple semesters of taking Chem 1, Chem 2, organic chemistry, I kind of decided that maybe that wasn't it for me. And when I actually got a shadow of pharmacy and retail and saw what they did every day, it was counting pills, printing out prescriptions, handing across and say, take this with food and water. And I couldn't see myself doing that for the rest of my life. I just needed a little more variety in my life. Nothing against pharmacists. They're great and valuable and important to the healthcare team, but that wasn't for me. So I knew I liked working with patients. So I switched my major to nursing, and I haven't missed a beat, and I've loved every minute of it.
Well, thank you both. I want to ask a couple more questions before I turn it over to Jaron, who's going to be looking at the chat. So if you're out there and have questions for Hunter or Brian, start putting those into the chat. So my next question for Hunter first, what are some of the most rewarding aspects of being a respiratory therapist or working in the respiratory therapy department?
For myself, and it can obviously vary for each RT individually, but for myself, I really love to be there for C-sections and deliveries of babies. I just think like what an honor that we're entrusted to take care of someone's most precious gift in this world. And so it's something that I find extremely rewarding.
What about you, Brian?
Yeah, for me, the most rewarding part of the healthcare profession is having an impact on people's lives. A lot of times we see patients come in with a life-threatening emergency. We get them over the hump. We teach them how to prevent that in the future, how to live healthier, more productive lives, as well as, sometimes we can't save everyone. So we get to impact the family's lives who's dealing with hard emotional issues and kind of support them through the process and giving them the resources they need to deal with what they're going through and move on. And you see our patients in the communities when you go out to Walmart. You may see a patient that you took care of, and they come up with a big old smile on their face, and they want to thank you for what you did for them. And that's kind of, to me, the most rewarding is the impact on people's lives that we have.
Well, that sounds very rewarding. Now I'm going to ask my third question about advice. Like, what advice would you give to individuals watching our virtual healthcare career today that are looking into a career at respiratory therapy or maybe working in a respiratory therapy department? Hunter, let's start with you.
I think the biggest thing, especially talking with high school students who are going into either respiratory or nursing, because they're both very similar schools, is just be aware of the time commitment that it's going to take. The material is doable. I think where the downfall occurs is that people underestimate the time commitment. And as far as new respiratory therapists, what I find the biggest issue is time management. So time. That's the key.
What advice would you give, Brian?
I would say definitely work on communication skills and team building efforts. Respiratory therapy works closely with physicians, nurses. They teach students. So, just kind of developing those skills of how to communicate better, how to share knowledge, how to ask questions. As a new person in healthcare, the most successful are the ones that ask a lot of questions and kind of say what they think they know, confirm what they know, and then move on. It helps them develop quicker throughout their career, as well as, helping in school. If you have questions, that's the best time to ask when you're in school. If you have questions about respiratory therapy and what it's going to entail, ask a lot of questions. The more you know, the better you're going to be prepared to make those decisions.
Well, thank you both. Jaron, I'm going to lean on you to see what kind of questions you're starting to see in the chat.
Well, good morning, Brian and Hunter. We have quite a few questions that have started to come in. And so maybe we'll first start with one, probably to you, Hunter. What's the name of the national certification that respiratory therapists would have or obtain when you're pursuing that credential degree or that field?
So it's the NBRC, the National Board for Respiratory Care, and we have a CRT credential and an RRT credential. This won't last for very much longer. It's pretty much going to be an RRT exam, registered respiratory therapist, and CRT is certified respiratory therapist. But the NBRC would like to do away with the certified credential and just go registered across the board. So.
Thank you. And maybe for you both, Brian and Hunter, Hunter, for you, how many years of school did your journey to become a respiratory therapist take? And maybe Brian as well, from your perspective, working in that department and working in healthcare. And for both of you as well, can it help to obtain your CNA if you are looking to work, even whether it's on the nursing side of respiratory care or on the respiratory therapy side?
Yes, absolutely. Obtaining your CNA, I think, is the best thing that you can do for yourself. Whether you want to be a radiology tech, a nurse, an RT, a physician. Have several friends who are physicians. They started as CNAs. I think that can give you a very clear picture about the healthcare field in general. As far as schooling for respiratory, it's typically 1 year, at least 1 year of prereqs, and then 2 years of the actual program.
I would agree with Hunter that having your CNA is an asset to no matter which part of healthcare you go into. It teaches you the skills of how to just walk into a room not knowing a patient and be able to have that conversation, get to know them, to connect with them as a person. It teaches the skills of how to transfer a patient from a bed to a chair, how to get them safely up and ambulating around the room, which no matter which part of healthcare you go into is a valuable asset to have. And we see that when our students come out of school, the ones that had their CNA and work with patients, they just kind of ease into their role as a respiratory therapist or as a nurse much easier and simpler because they can really focus on their new knowledge that they need to put to use, not so much on the day-to-day, how do I interact with the patient, how do I get them moving, ambulating, et cetera. As far as nursing, you can go through a 2-year associate degree program, or you can go on and immediately get your bachelor's. Both are very successful in healthcare.
Well, and thank you. And building on that as well, another question, just, Hunter, to clarify as well, it sounds like the respiratory therapy programs overall are maybe associate degree, or are there bachelor programs as well? Or is associate really the level where you would obtain your respective degree for that?
Yes, there are. There's several bachelor programs, even here in Kansas. KU is one of them. Um, me personally, I would go for the associate program and then go back to get your bachelor's just so you can start working faster. But different people have different goals. If they would like to just go ahead and start with their bachelor's, I have several staff members that have done that as well.
And would you both say you have, similar perspectives, but, slightly different as well? Would you say respiratory therapy is an in-demand career? Are you looking to, hire respiratory therapists? Are colleges graduating enough? But really, are there going to be some jobs available for folks if they were interested in respiratory care?
Yes, there will be plenty of jobs. It's not only in Hays, but Kansas as a whole. There is a massive shortage of respiratory therapists. We're opening up a school here in Hays to try to meet this demand, but it's a heavy investment on our part, and it's going to take at least 2 to 3 years for that to pay off. But yes, all of my colleagues at other hospitals, they're always looking for RTs. We network together, and there's a shortage everywhere.
And Brian, it sounds like you might echo those same sentiments.
Yeah, I would say that there's always going to be a demand for respiratory therapists because they do have that specialized knowledge to treat those patients with respiratory needs. I mean, nurses cannot take place of a respiratory therapist. The respiratory therapists are the experts in managing the airway, helping the patient get off the ventilator sooner, have better outcomes, and they are very knowledgeable about giving the patient the education they need to go home and do practices to prevent rehospitalization. So much needed. I was also going to piggyback on Hunter's statement that, there are ways to branch out from respiratory therapy. A lot of respiratory therapists go into hospital management as leadership. And then there's also bridges from RN to RT, RT to RN. I think there's a paramedic to RT within the state. So, healthcare is very fluid. So just because you start out on one path, you may decide that I don't want to be a nurse, but respiratory therapy is really cool. So then they move on to that. So there's always a fit for you to start your career in healthcare and then branch out from there.
Thank you both. Another question we received, and really it's maybe timely. So folks are hearing about the potential tuberculosis outbreak in more of the northeastern part of the state. And so somebody did ask a question, what is the role of the respiratory therapist? What does that look like when you maybe are treating a patient if they would have tuberculosis or maybe similar conditions? Hunter, maybe if you want to start with that.
Well, it would depend on the severity. Some patients we might not have to do anything with. They might have very mild symptoms, and some could be very severe. They might be on a ventilator or a BiPAP. A BiPAP is a mask that pushes air inside their lungs. You may have seen people like when they're sleeping, like maybe someone that they put it on for sleep apnea. So that type of same mask we use to treat respiratory illnesses when they're not getting enough oxygen into their bloodstream. That's very, very common with tuberculosis patients. So it would just depend on the severity, but it could range pretty widely.
Thank you, Hunter. Just maybe a few more questions as we're nearing the end of this segment that we've received. For the next one, what qualities or maybe skills should students or other individuals that are watching today, what might they look for or really maybe what you're looking for in a respiratory therapist or might make someone a good respiratory therapist or working in respiratory care? Brian, would you maybe want to start with that?
I would love to, Grant. Thank you. I'm looking for people skills and the ability to work as a team. We can give you the knowledge and teach you how to run the equipment behind us. But if you can't work as a team and you can't communicate with your patients, you're not giving them the full care that they deserve. You may forget to communicate something to the physician that impacts the patient. The patient may not trust you if you can't approach them and let them know that you care for them as a person, which means they may not give you the information that is important to help them get better and move on. So to me, it's communication, teamwork, people skills, and really kind of caring from the heart and loving what you do, having an interest. If you're coming into healthcare because you hear it's a good paycheck, you're not going to be happy. It's going to show in your work, and it's probably the not best fit for you. So really have that passion, teamwork, communication.
Hunter?
I think he stole my answer. So I totally and 100% agree. For me, we can give you all the knowledge in the world. If you cannot communicate and get along with coworkers, in your department or the nurses or the physicians, that's just not a good quality to have. So that's what I stress all the time is people skills, communication skills. People think just because they're an introvert, they're an introvert their entire lives, but you can absolutely work on your communication skills. I'm an introvert, and yet here I am. I talk in front of, 50 to 100 people routinely. I'm on camera now, so you can absolutely work on it.
Anything's possible. That's great. Well, the last question we'll have time to get to, how would you say your knowledge compares when you're working in respiratory therapy directly in, let's say, the hospital setting versus someone who maybe is working more in emergency care, including like the ambulance? Is there a comparison or just a reference you might be able to provide on that?
I think I could could a little bit. In the hospital, we're kind of looking at long-term effects for the patient. Uh, we want them to be healthier in the long run. When you're on an ambulance, you're trying to get them to the hospital alive as fast as you possibly can. So it's just different perspectives on and how you're viewing the patient. But I think as nursing as well, like Brian could chime in and kind of give his perspective as well, because it's a little bit different for respiratory and nursing.
Brian?
Yes, one of the goals in the hospital versus the emergency setting is, like Hunter said, it's more stabilizing them, get them here in the best condition so that we can treat their long-term needs. So we're looking at, they might not be looking at reducing fevers or starting antibiotics or, really getting them healthy long-term. So we're working on goals. If they're decompensating, we're looking at getting them stronger so they can move back home and be successful. If they come from a nursing home, so they can go back and work within their community and play the games that they want to. Well, so we're focused more on, like you said, the long-term outcomes, but it's also a lot more complex when you're looking at the medical management, the treatment of the patient, because you have a lot more options and different ways to meet those goals.